Raise your hand if you think the American healthcare system is broken. Raise your hand.
Majority, everyone.
Not a majority, virtually everybody
pretty
in the room.
The United States of America spends almost twice as much money on healthcare than any other country in the world, yet over 78 million United States citizens still don't have access to adequate and affordable medical care. Despite the United States being one of the wealthiest countries in the world, the reality is that tens of millions of citizens are unable to get proper medical care when they need to, because they can't afford it. Due to this lack of accessible care, over 68,000 American citizens die every year, simply because they can't get to a doctor on time. Their deaths are not the result of incurable diseases or unavoidable tragedies, but the result of systematic barriers in healthcare. The United States relies primarily on a privatized healthcare system, which operates under a capitalist framework and depends on private insurers, corporate ownership, and employer-based coverage. Although this system of care has allowed the United States to advance medical technology and quality of care, it has been criticized over the years for its high costs and unequal access to care. In response, many United States politicians, such as Senator Bernie Sanders, have established government-funded programs such as Medicare and Medicaid to expand access to care for certain individuals. Today, many citizens across the country are pushing to adopt a universal healthcare system with the hope of improving public health and access to care. However, many other citizens are more cautious about adopting a universal system due to potentially high costs and lack of efficiency. On a deeper level, many physicians working in the United States healthcare industry are divided as well. While most physicians have expressed hope that expanding the current universal systems like Medicare and Medicaid may benefit public health, other physicians are more hesitant towards the idea due to the added work and decreased funding for specialized and preventative care.
It's not about healthcare. It's about economics and it's about politics.
America's failing healthcare system can be attributed to the corporatization of the healthcare industry. Over the past several decades, capitalism in healthcare has resulted in rising medical expenses, creating financial barriers to basic and necessary medical care. With increasingly limited accessibility, rising medical costs, and thousands of preventable deaths each year, it is clear that the system is harming the very people it is supposed to serve. On a more specific level, capitalism has proven to play a direct role in shaping the quality of public health in this country. The healthcare system has been designed to prioritize financial profit over public health. Due to private insurance and pharmaceutical corporations and investors pouring money into the industry, the majority of preventable and specialized medical care is only accessible through paywalls, essentially creating a financial barrier to life-saving medical research. This financial barrier has directly harmed cancer research. A 2024 study examining the relationship between corporate capitalism in the healthcare industry and cancer mortality rates in the United States revealed that a third of cancer deaths could have been avoided if socioeconomic disparities were eliminated. In other words, the current privatized system of American healthcare is the cause of unnecessary suffering and death for thousands of American citizens every year. Dr. Adam Brown examines the conflict between capitalistic incentives and effective, compassionate patient care. From his perspective as an emergency physician, Brown describes how the dysfunction of a system without appropriate regulation results in unequal treatment, dissatisfied patients, and physician burnout. Due to the incentives laid out by the privatized healthcare model, many physicians are forced to prioritize financial gain over patients' needs. While Brown acknowledges capitalism's role in expanding preventative care, he expresses on behalf of himself and his medical peers that capitalism without appropriate levels of regulatory control results in unequal treatment, hospital closures, clinician burnout, ignored patients and families, and erosion of the social contract. Ultimately, Brown recommends that increased government oversight of the healthcare system can benefit both patient care and the environment medical professionals work in. The Organization for Economic Cooperation and Development outlines a clear and positive correlation between wealth and health in the United States, explaining that privatization is more beneficial to people with higher incomes, as opposed to public healthcare systems that have statistically lower mortality rates among citizens. Information from Centers for Medicare and Medicaid Services supports this data by detailing how the amount of healthcare spending has increased over the past few years, and despite this, the United States still has the lowest life expectancy among its industrialized countries. This is due to the amount of money doctors' appointments and medications cost citizens on a day-to-day basis. In contrast to the United States, countries that have implemented universal healthcare systems consistently experience better public health outcomes. Extensive research conducted on universal healthcare has revealed that implementing a universal healthcare system in the United States has the potential to improve accessibility and cost effectiveness. Universal healthcare programs around the world have proven to be effective in not only providing equitable access to care, but also in reducing the amount of medical spending. Critics of universal healthcare often argue that this type of system leads to increased taxes and government spending. However, research has consistently proven that universal healthcare lowers the total medical cost for individuals and communities. For example, countries with universal healthcare systems such as Sweden have shown to have statistically lower mortality rates than the United States. This is due to Sweden's universal healthcare system prioritizing equitable and affordable access to care, rather than financial profit. Studies on the effects of privatization versus universal healthcare have revealed that many people living with a universal healthcare system have expressed positive opinions about access to care and reduced financial burden. That is to say, universal healthcare has not only proven to increase quality of life and overall public health for a country, but also to decrease financial stress for its citizens.
The fact that healthcare is a human right, for the fact that we waste enormous amounts of money on administration and on profiteering and on advertising. For all of those reasons and more, today, Pramila, Debbie, and I are introducing Medicare for All single-payer legislation.
Medicare and Medicaid programs have already improved the quality of life for millions of people in the United States. Expanding the roles of these programs in our healthcare system has the potential to help all United States citizens. Studies that have researched the effects of implementing a universal healthcare system have cited that Medicare has proven to improve health and cost effectiveness for patients. Since its implementation, Medicaid has become the most cost-efficient health insurance program in the United States. Medicaid has shown to have had a lower cost per service provided than any other public or private health insurance program. Studies have shown that the cost to cover low-income adults through Medicaid was about 45% less than covering a similar group through private insurance. Since Medicare has been implemented, it has significantly and cost-effectively improved the health of previously uninsured recipients. Ensuring healthcare access for all Americans has the potential to save over 68,000 lives every year. Returning to the earlier study on the relationship between capitalism and cancer mortality rate, researchers found that there is a significant relationship between Medicaid expansion states and increased mortality rates as opposed to non-Medicaid expansion states. In other words, states that have incorporated Medicaid programs have effectively improved public health and increased cancer survival rates. Every single American citizen, one way or another, is affected by the healthcare system. For those who remain uninsured due to financial barriers, the system serves as a daily source of fear and unreliability. For those who are insured, the system forces them to live at the whim of privatized insurance companies, consequently paying high prices for doctor's appointments and medications. If our current system of healthcare remains unaddressed, American citizens will continue to struggle with limited and costly access to care from private insurance companies, resulting in tens of thousands of preventable deaths each year. In contrast, carefully implementing a universal system has the potential to benefit public health, expand access to affordable care, and save countless lives every single year. The American people deserve a healthcare system that prioritizes human well-being over corporate profit. The lives of tens of thousands of American citizens are at stake each year that passes without fundamental change. To protect those lives, citizens must demand action through calling representatives and supporting candidates who advocate for universal healthcare. Impactful change to the healthcare system is possible, but only if the American people fight for it.
Care is a human right, not a privilege. The function is to guarantee high-quality health care to all people, regardless of their income, not to make huge profits for insurance companies and drug companies.